Thank you very much, ladies and gentlemen, for inviting me to come and talk to you today. It's an absolute privilege to be here. And what I thought we would talk about today is something completely different to what we've heard about in the last half an hour. And it's about how lawyers and neuroscientists can collaborate to achieve or provide quality of life. So I thought I'd start off by telling you a little bit about myself so that you understand my background and where I'm coming from. As mentioned earlier, I'm the Vice Chair of the Spinal Injuries Association, which is a national spinal injury charity in the UK. I'm a patient representative for NICE, which is the National Institute of Clinical Health and Excellence. I'm an associate solicitor at Bladder, which is a firm of solicitors in London. And I specialise, it's the only area that I know, in personal injury and clinical negligence claims. So I thought we'd start off today discussing the two professions. And you've got lawyers in one corner, and you've got neuroscientists in the other. What do we know about lawyers? Well, we're money grabbing, we're litigious, ambulance chasers. You see those 4 p.m. TV ads for the no win, no fee solicitors. We're expensive, and quite often people complain they're a lot poorer after they've been through a legal claim. Correct? What about neuroscientists? You guys are intelligent. You're on the cutting edge of science, you save lives, you're developing humans, and you're doing it for love and interest and not for money whatsoever, right? Thank you. So, bearing that in mind, is collaboration even possible between the two professions? Well, my understanding, correct me if I'm wrong, is that all of you are in your early stages of career at the moment. And one point I'd like you all to take from this presentation is that collaboration with other disciplines is the future. It's absolutely key. You have to work with other disciplines. And the purpose of today's talk is I'm going to talk to you a little bit about what it's like to have a spinal cord injury, and then I'm going to talk you through what I did with one of my cases of a lady who had sustained a brain injury. And we're going to talk about how neuroscientists were involved, what my role as a lawyer was, and what our common goal was. So what is the common goal? Well, I'm going to say in today's presentation, the common goal is quality of life. Because whatever you think about lawyers, personal injury and clinical negligence solicitors, they do it because they want to help people who become injured. And as neuroscientists, or medics, or other lawyers in the room, you're all here because you want to help humans. And that's the fundamental goal. So what we do know is that people who sustain catastrophic injuries are surviving longer than they ever used to. And that's because of the amazing technological advances that have occurred in the last, 10, 20, 30 years. The life expectancy for someone who had sustained a spinal cord injury, which is what SCI stands for, in the 1950s was 2 years. That means within 2 years of you becoming paralysed, you would die from secondary complications relating to paralysis. Children who develop cerebral palsy, which is usually due to some sort of oxygen problem, either just as they're being delivered or at birth, probably wouldn't have survived that 20 years ago. And people who sustain brain injuries would die at the scene. You do have some purposes as my younger brother after all. Okay, so just to reiterate that for people who sustain a brain injury, perhaps through a road traffic collision or something like that, the advances in that, paramedics at the scene probably wouldn't have been able to keep them going long enough for them to reach A&E. So we've got lots of people living longer than they ever used to with very, very serious injuries. But not everyone is able to bring a litigation claim. It's not always possible to attribute blame to something. And actually, I'm going to talk a bit about the mics, as long as you can hear me. So I'd say actually 10% of clinical negligence cases succeed. So that means 90% of clinical negligence cases fail for one reason or another. Because it's not enough to show that something went wrong. You have to show that negligence occurred, and the term negligence is a really high threshold. Claims for personal injury are easier, but I would say they actually generate a much greater public outcry. And if you listen to David Cameron, he's adamant that this compensation culture exists. It doesn't. If you read the papers, it does not exist. So what is the purpose of bringing a litigation claim? Well, it's quite simple. It's to put the person back in the position that they would have been in, but for the negligence. It's not to give them loads and loads of money because they were injured in a really traumatic way. It's to say, right, where were you in life at the point of accident? Where are you now after the accident? What are your extra costs? And the extra costs for your injuries are what's claimable, nothing else. So let's take a step back and let's consider what a catastrophic injury actually is. And I would say it was anything that dramatically affects a person's fundamental cognitive or physical faculties, which results in substantial care and expense. So before we go any further, I want you to just take a minute, and I want you to shut your eyes, and I want you to imagine something. I want you to imagine your home. What does it look like? How do you get in and out of the house? Is it 2 stories, 3 stories? Is it in a mansion? What about your office, your university, your department? Whereabouts is that based? Think about the last holiday that you went on. How you travelled on your last journey. How did you all get here? And now I want you to try and imagine what it's like to have a catastrophic injury. A brain injury, a spinal cord injury, an amputated limb. And now I want you to try and imagine how you get to your home, how you'd get to work, how you'd go on holiday, how you'd travel and carry on your day-to-day business if you have this injury, and what your quality of life actually is. I want you to have that in mind as we go through the presentation. Okay, open your eyes. You're very diligent. The only way I can describe a catastrophic injury is that it's ball change. I'm going to tell you a little bit about what happened to me. I became paralysed when I was 11 years old in 1993 following an operation which went wrong. I had surgery on my spine to correct scoliosis, which is a curvature of your back, that's not my x-ray, but it's an idea of what your spine would look like. I am what they describe as T6, T7 incomplete, which means I'm paralysed from about my diaphragm down, and incomplete insinuates that I can't walk at all, I have no motor function, but I do have sensation. And what they like to class a non-traumatic injury, because becoming paralysed has its varying levels of trauma, apparently, according to the doctors. I spent 3 months in a private hospital, which is where I became paralysed. I then was transferred to Spinal Injury Unit, which is a specialist rehabilitation centre, and I spent 6 months there. And I've now spent 20 years as a paraplegic. I'd like to think I'm fairly authoritative on this topic. I live independently. I travel, I drive, I ski, I fly plane, and I work full time. So how did I get there? Because for me, the paragraph of all the things that I do is what gives me quality of life. So the first few weeks when you sustain a spinal cord injury is actually quite emotionally draining. You're exhausted, your body's in shock. You're lying in bed, you've got doctors trying to figure it out what's going on, and no one can really give you any answers. It's all a wait and see game. You're pretty much making lists of things, all the things that you're never going to be able to do again. And it's simply too early to try and comprehend and appreciate the full impact of your injury. One thing I always remember very vividly trying to record is if 2/3 of your body doesn't work, doesn't move, you've got no control over, how do you do something as basic as sitting up? It's a manoeuvre that we take for granted as an able-bodied person. And I was initially worried about how I was going to sit up. What I did know is that if I could sit up, I could get out of bed. If I could get out of bed, I could use a wheelchair. If I could use a wheelchair, my rehabilitation could really start. If my rehabilitation could start, I could get my life back. So how do you sit up if you're paralysed? And you've got to excuse the modelling involved in these pictures. I blame the photographer. This is me lying in bed. So you lie flat, you grip the sheets, you pull the sheets up and you push up at the same time. Then you push up with your arm into an upright position. Easy, right? How long do you think it took me to master that maneuver? 3 weeks. Because I was exhausted. It was an effort. I'd been lying in bed for 6 to 8 weeks. My muscles had wasted away. And you're asking me to effectively move a dead body, which is what my body felt like to me. And then at the same time, you're trying to get to grips with what the words paralysed and paralysis actually mean. So people immediately assume mobility is affected, and that's correct. But just because you can't move doesn't mean you automatically can't feel. And people make that mistake all the time. Now I am a bit weird. I can actually feel, but I can't feel everything. So I can't feel pain, which is interesting given the topics we were discussing earlier. I can't feel hot and cold, which again, what Mariah was saying about the hot cup of tea. If you put a hot cup of tea in my leg wouldn't move it away. So I would burn myself. I can't feel itchiness, which is great in Spain when you're being bitten by mosquitoes. But I am still ticklish. And if you kick me underneath the table because I'm talking too much, I will stop talking because I can feel that too. So that's for all of you to go off and explore why I can feel some things and not others. But it's a misnomer to think I can't feel anything at all.
You feel touch, just like,
yes. Yeah. Then we get on to sexual dysfunction. Again, most people assume that when you become paralysed, that's it, sexual function goes. Well, yes, if you're a man to some extent. Women, completely different ballgame. And it's very much an individual thing. Whoever thinks of bladder and bowel dysfunction occurring the moment you say the word paralysed? I would say most people don't even consider it. When you sign away your life on those consent forms for operations on your spine and it says the risk of paralysis, the number of times I have clients that come back to me saying, I could cope with the idea of never walking again, but no one told me that my bladder and bowel function would be impaired. Fair point. So what can we do? What can we do about quality of life? Well, stem cell research is going to be the way forward. And I think this diagram sums up all the ways that stem cell research will help people. But it doesn't help me because I'm already paralysed. It doesn't help anyone who's become paralysed today, and it won't help anyone who becomes paralysed tomorrow. But it will eventually. So in the meantime, we've got to find other ways of providing quality of life. So what do I consider to breed quality of life? Is it the ability to walk again? This person is Sophie Morgan. She's a TV model and presenter. She became paralysed in a car accident about 10 years ago. She's the same age as me, more or less. And she is standing on what they call the exoskeleton. And this is a picture she took this week and put on her Facebook page. It's a great big chunky device. But she stands up. She can't probably do a huge amount of it, but for her, she thinks this is the best thing since sliced bread. What about rehabilitation? Is that actually enough? This is Sophie testing out the latest, sexiest wheelchair possible. It's a carbon fibre wheelchair. It costs £10,000. I'm going to try one out tomorrow. But this is Sophie modelling it. So is it that actually, if you have a really super duper piece of equipment, you've got your quality of life because you can do all the things that you want to do. This chair, to give you an idea of how much this is and how battered it is about £2,000. So this is a markedly more expensive chair. But you're not going to be able to use your wheelchair until you've learned how to sit up, until you've learned how to transfer from your bed to your chair, and then until you've actually learned how to move around in a wheelchair, which is sometimes a lot harder said than done. And we did talk about bowel and bladder function. And when you have a spinal cord injury, you generally get two types of bladders. You get the bladder that overfills and doesn't know when to empty itself, which is a problem because the urine backtracks to your kidneys and you end up with all sorts of nasty problems. And then you get the other type of bladder where it thinks it's full but it's not. So what it effectively does is this the whole time. Now if it's doing this the whole time, it's sending messages to your brain telling you you need to go to the toilet and you don't. And you feel that you're going to have an accident. So you constantly are either limiting your fluid intake because you don't want that to happen, or you just don't leave the house because you've got to be near a disabled toilet every single time, which impacts where you can go out, how long you're socialising for, how many places have you been to where you've had men and women in disabled toilets, but men and women's normal toilets, but no disabled toilet. Okay? So Botox, what that does is it's a paralysing agent, and you inject it into the bladder and it relaxes the muscles. And when it relaxes the muscles, I no longer get sent messages telling me that I need to go to the bathroom, which means that I can go for 4 hours, which might sound like a long time, but it is actually when you're constantly thinking, oh my gosh, is this cup of tea going to go through very fast? Because that's what we think about when we're paralysed. It means that I can actually now go out and not have to worry, I can enjoy myself. For me, I would take having bowel and bladder function over the ability to walk, and I'm not in the minority. I would say about 80% of people. If you lined up 2 things, do you want to walk again, or would you like to have bowel and bladder function? Paralysed people will opt for bowel and bladder function. There is also, it's been in the news recently, about prosthetic bladder, so it'll be interesting to see how that impacts on quality of life for people. So I've spoken about what I perceive to be quality of life. So how do lawyers help those with spinal cord injuries and other catastrophic injuries? And the point is that we all know that early rehabilitation improves prognosis. It's without a doubt key and fundamental. But you don't always know what your rehabilitation is. So as a lawyer, I ask my experts, who are usually doctors, who prepare reports, and tell me what needs does my client have? Because you, as a doctor, you might see hundreds and hundreds of people who are paralysed, but for that client, that individual, this is the first time they've ever become paralysed, so they don't know what they need. You need someone to guide you about that. And then they tell me what the rehabilitation is, and they say, well, you probably need some equipment, and they tell me what the equipment is, and that's constantly developing depending on what the technology is up to. And then usually you need a care package, so you need people to provide you with physiotherapy or actual care, depending on what type of injury you've got. And the care package is pretty expensive. At the lower end, if you're spinal cord injured, I would say that costs about £50,000 per year. At the high end, when you've got a very serious brain injury, you're looking at £250,000 per year. Now, who here has a spare £50,000 in their bank account? You don't. You don't have that money. And no one, you hear people talk about they might take out some sort of health insurance because they might have a heart attack one day, or they might have a history of cancer, and they might prepare for those life events. You never hear anyone say, well, I might become paralysed, or I might become brain injured. It's a bit of a negative way of thinking about it. But the point is, those 2 types of injuries are incredibly expensive to care and treat for. And so people have to bring a claim for compensation. And they have no choice but to bring that claim. No one who becomes paralysed thinks, yippee, I know what I'm going to do. I'm going to get to grips with the fact that I can no longer walk, that I might have sexual dysfunction, that I might have bowel and bladder function. And I know I don't have enough on my plate as it is. Let's commence a 5-year litigation thing. No. No one wants to do that. But if they don't have, if the NHS is brilliant in the acute stage, but it's not there for the rehabilitation stage, and you've got no other choice but to bring a claim. So now I'm going to move on to the brain injury, because that's when the real collaboration begins. With spinal cord injury, you tend to see a lot of doctors inputting at the early stages of rehab, but brain injuries are a different ballgame altogether. So I'm going to tell you about a client that I'm going to call Tanya. And Tanya was a pedestrian. She was hit by a motorcycle doing 60 miles per hour in a 30 mile per hour zone. She was 28 years old, she was a high flyer. She'd got her first, she was working for a commercial company, and she'd been earning $100,000 within a couple of years by the time she was 30. Tanya sustained incredibly severe head injuries. Probably some of the most severe head injuries some of our experts have seen. So what are the top tips? Well, our opinion of quality of life can differ to the affected individual. Think back, as neuroscientists, you might be thinking, yeah, let's try and get people who are paralysed walking again. Well, fantastic. But don't forget the bowel and bladder function, which actually some of them more paralysed.
some people who are paralysed may consider to be a greater benefit to them than the ability to walk again. It's not to say that you shouldn't make technical advances, you should. You shouldn't lose sight of the fact that you have to deal with the day-to-day issues. It's great that you can keep people going. But if you are going to keep people going for longer, you've got to make sure that they aren't floundering and that you still have quality of life later on. So, my message to you is that professions can and should work together. You saw that the way that we put the care package together for Tanya. You need lawyers to prove the losses and obtain the funds. You need a variety of healthcare specialists to deliver the